Hello everyone, welcome to the fourth part of heart valve disorders. In this video, it's all about aortic valve disease. So let's dive into the details of aortic insufficiency. And don't forget to like, share, and subscribe to our channel, and stay tuned. What's up everyone? Today we're exploring aortic regurgitation, where blood takes a wrong turn and flows back into the left ventricle from the aorta during the heart's rest phase, diastole. This can happen because of a birth defect in the valve, like a bicuspid aortic valve, or inflammation that wraps the valve leaflets. Sometimes the aorta itself gets too big and stops the valve from sealing shut. And other culprits include infection like rheumatic fever or syphilis, or an aortic aneurysm that stretches or tears the aorta, or a hard hit to the chest, or a valve replacement that's seen better days. Now let's talk about what's going on inside. Normally blood flows into the left atrium from the aorta, but with aortic regurgitation it's like a U-turn back into the left ventricle, which then has to stretch out to fit all that extra blood. Over time, the left ventricle hypertrophies to expel more blood with above normal force, thus increasing systolic blood pressure. And your arteries try to chill out to handle the pressure by relaxing, which drops your diastolic blood pressure. Most people with aortic regurgitation don't feel a thing at first, but some might sense their heartbeat thumping away, especially in their head or neck. And if the left ventricle gets really muscular, you might see or feel your carotid or temporal arteries pulsing because they're pushing out more blood. As things get serious, you might get winded easily and feel tired, and if the left ventricle starts to fail, you'll have trouble breathing, especially when lying down or at night. Diagnosing this condition is like listening for a high-pitched whistle at the third or fourth intracostal space at the left sternal border during the rest phase. And if the difference between your highest and lowest blood pressure readings is huge, that's another clue. The water hammer pulse is a classic sign. It's like a strong surge that claps quickly. Echocardiograms, heart MRIs, or heart catheterization can confirm the diagnosis. To keep aortic regurgitation at bay, dodge bacterial infections like the plague. That means treating strep throat pronto to avoid rheumatic fever. If you've got symptoms or your left ventricle is struggling, take it easy. No heavy lifting or sprinting until you get that valve sorted. If your heart rhythm goes haywire or you start getting heart failure, those need attention too. Look, keeping blood pressure in check is key, and ACE inhibitors and dehydropyridine calcium channel blockers can help by easing the heart's workload. Beta blockers are maybe, as they might actually bump up the pressure by slowing the heart rate. If you're feeling the symptoms, cut back on salt to avoid overloading your heart. And when it comes to fixing the problem, replacing or repairing the valve is the way to go, ideally before the left ventricle throws in the towel. Now, let's shift our focus to the aortic stenosis, a condition that narrows the path between the left ventricle and the aorta. Stick around as we dive into this. Alright, let's chat about aortic stenosis. It's like having a narrow doorway from your heart's main pumping chamber to the superhighway of your body, the aorta. In grown-ups, this narrowing is often due to the calcium deposits, kinda like the gunk that builds up in old pipes. Calcification may be caused by proliferative and inflammatory changes that occur in response to years of normal mechanical stress, similar to changes that occur in atherosclerotic cardiovascular disease. Sometimes you're born with a valve that's a bit off, like having 1 or 2 flaps instead of 3. And if rheumatic fever has had its way with the valve, it can get sticky and stiff, with some calcium lumps for extra blood. Aortic stenosis doesn't rush. It takes its sweet time, getting worse over many years. The left ventricle has to pump harder to get blood through that tight spot, which makes its wall beef up and gets bigger. A lot of folks with aortic stenosis don't feel anything at first, but when they do start to feel something, it's usually getting out of breath when they're active, because the left ventricle is working harder and the lungs are under pressure. If the left ventricle starts to lose steam, you might feel breathless even when you're lying down or at night. And if the blood flow to your noggin drops, you could feel dizzy or even faint. Chest pain can also be a sign because the heart muscle is working over time without enough blood supply, especially when you're moving. Blood pressure might look okay, but if the flow is really low, it could dip too. When doctors check you out, they might hear a loud, rough sound over the aortic area, the right second intercostal space when the heart beats. And they might feel a buzz along your neck arteries because of the rough flow. The murmur may be described as low-pitched, rough, rasping, and vibrating, and an S4 sound may be heard. By having the patient leaning forward during auscultation and palpation, especially during exhalation, the murmur may be accentuated. There may also be a palpable vibration extending from the base of the heart and up along the carotid arteries. The vibration is caused by turbulent blood flow across the narrowed valve orifice. Keeping tabs on aortic stenosis involves heart scans like echocardiograms or MRIs or computed tomography scanning. Patients with symptoms usually have echocardiograms every 6 to 12 months, and those without symptoms have echocardiograms every 2 to 5 years, depending on how severely the orifice is narrowed. And if the stenosis is bad enough to think about surgery, they'll do a heart catheterization to measure how severe it is and check out the heart arteries. To prevent aortic stenosis, it's all about managing things like diabetes, high blood pressure, high cholesterol and triglycerides, and steering clear of tobacco and vaping. For treatment, meds might be used for arrhythmias or heart failure, but the real fix for aortic stenosis is replacing the aortic valve, either with surgery or a less invasive method called TAVR. If you can't have surgery, a balloon procedure might help ease the symptoms. That's the rundown on aortic stenosis. Remember, taking care of your heart is crucial, so stay informed and proactive. In the next video, we will talk about different surgeries and treatments. Until then, make sure to hit that like button, share this video with your friends, and subscribe for more. Until next time, stay healthy, stay informed.